Good morning, Exercise Science. It's Thursday, April 23rd. This is the third lecture for the Chapter 12 Cardiovascular System. I finished last time with a pretty intense topic lecture. Not intense in the fact that it was difficult to understand, hopefully, but the fact that probably of anything this year that I've gone over with you that I need you to kind of memorize, to understand the pattern of blood flow through the heart, and more importantly, understand where it's going, where it's coming from, what condition it's in, and why the heart's beating in the first place. So that last lecture, if you haven't watched it, please review that before the assessment, and make sure that you are really up to speed on understanding the pattern of blood flow through the heart. Today we're going to move on with some other topics. We're going to talk about regulation of the heartbeat. We're going to talk about the coronary circuit, and we'll probably leave it at that. I want to make this one a little shorter than the last one. This will go, obviously, to the third set of questions, which I'll post sometime later today or early tomorrow. I'll probably do sometime over the weekend or on Monday. The coronary circuit, to understand the physiology of the heart, it's kind of counterintuitive. The heart is constantly full of blood. Why would it need its own blood supply? But it does. So in the aorta, this bad picture of a heart that I've drawn back here. In the aorta, if you were to cut the aorta open and feel along its walls, you would find a little opening, and that opening is the beginning of the coronary circuit. That will give rise to a system of vessels and arteries that are going to nourish the myocardium. They're going to come out on the surface of the heart. You can actually see these when you do a heart dissection. There's four major ones that you can see in the anterior surface of the heart. And what they do, obviously, is break off into capillaries and supply each of the individual myocardial fibers, muscle fibers, with blood supply, with oxygen, most importantly, and with the nutrients that it needs to release energy, since the heart's always beating. So the coronary circuit's pretty important. And again, once it does its thing, just like any other circuit in the body, those blood will go into the capillary networks. Capillaries will nourish the tissues, and then the capillaries will withdraw the fluid, the blood, and take it right back into the right side of the circulation of the heart, and then the whole process repeats itself again. So again, understand what the coronary circuit's for. It's to nourish the actual heart tissue. If we have issues with those arteries that supply the heart tissue with blood, then obviously we have cardiovascular disease, cardiovascular disorders, myocardial infarction, or an MI, also known as a heart attack. That's when the myocardium doesn't receive enough oxygen supply, and subsequently it's going to suffer and could die. Can obviously cause a person the entire person to die, not just the heart tissue. Heart attacks, something that you need to be very cognizant of as you treat your patients. Obviously, if you're pushing them to their limits physiologically, you have to understand underlying conditions. If they already have myocardial diseases, peripheral artery diseases, these things you have to be aware of. So something to kind of keep in mind. Now, let's go to the next topic. Regulation of the heartbeat. The heart just doesn't beat on its own. It's just not a magic thing. There's not somebody sitting inside of your heart telling it when to beat. Obviously, it's a two-stage beat, as I mentioned in the last lecture. It's the lub-dub. That's the atria contracting, sending the blood to the ventricles, and then the second stage of the beat is the ventricles contracting. So let's start with the internal regulatory mechanisms, the SA node and the AV node. SA stands for sinoatrial. AV stands for atrioventricular. And what each of those do, they're tiny little nodes of tissue. We talked about these back in Chapter 8 called the ganglia. And they're little nodes of nervous tissue, little control centers that control the rhythm of the heartbeat. That's the importance of these two, the SA node, the AV node. The SA node is going to fire first. So when I say fire, it's going to send out its nerve impulses. And what it does is it causes the atria to contract. It will be shortly after followed by the AV node. The AV node is triggered by the SA node. They work in conjunction with each other. That's going to cause the ventricles to contract. So basically, if you can see in this diagram back here, I have two little green dots drawn, and I'm going to move out of the way. Again, this is just a basic schematic representation of the heart, but both of these are located in the upper right portion of the heart, the SA node and the AV node. So when the SA node fires, what happens is you get kind of like an umbrella-shaped nerve impulse sent out through the tissue of the upper part of the heart. So if you can visualize it going like this direction and causing the two atria to contract like that, that's going to stimulate shortly after the SA node, or the AV node rather, to contract or to send out its nerve impulses. That's more like an upside-down umbrella-shaped nerve impulses. So if you can visualize nerve impulses traveling down the septum, which is the separator between the left and right sides, and kind of going back up this direction, that is what the AV node does. So you have nerve innervation to the entire myocardial aspect of the heart, SA node and AV node. So that controls the rhythm of the heart. Bum, 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 bum. SA node, AV node. Some other things to control: overall heart rate, medulla oblongata, we talked about that, part of the brainstem. The vagus nerve, cranial nerve number 10, when it is stimulated, it will cause the heart rate to decrease. Patients sometimes will experience this when they're exercising, and you have to be aware of this as well. It's called a vasovagal response or a vagal response. When the vagus nerve fires, it causes the heart rate to decrease. That's not a bad thing, unless you decrease it too much and you don't get enough oxygen to the brain. So what's going to happen to your patient? A lot of times when patients are in pain, or just the general pain response is to clench up like this, hold your breath, and when you do that, you compress your thoracic cavity. That stimulates the vagus nerve. That causes your heart rate to drop. That's called a vagal response, and that can cause the person to pass out. So you have to be careful with that. Some people have an underlying condition that makes them more susceptible to having vagal responses. All right, and the last part, sympathetic and parasympathetic branches of the nervous system. I see it looks like there's a glare on the board from my angle, what I'm seeing right now. So this is sympathetic and parasympathetic branches of the nervous system, the autonomic nervous system, obviously in conjunction with the endocrine system, hormones being released in each case. The parasympathetic, or rather the sympathetic nervous system, is going to cause the heart rate to elevate. That's the fight or flight response. So that, in conjunction with adrenaline being released, causes the heart rate to increase, and the parasympathetic is just the opposite. That's going to bring the heart rate back down. That's what you're functioning at, hopefully, right now as you sit here watching this video. Parasympathetic control is going to keep our numbers at baseline, the heart rate normal and everything like that. But overall, with the assistance of acetylcholine, which is the hormone that mediates this, it's going to bring that heart rate down. So SA and AV node control the rhythm of the heartbeat. Medulla oblongata controls the heart rate. Vagus nerve decreases heart rate. Sympathetic is going to increase heart rate, and parasympathetic decreases heart rate. Have a good day. Probably one more lecture before we move on to the assessment for this chapter.